Hi, everyone. Welcome to another P.A.D. Lifesaver Hotline podcast. We have a great live studio audience. So excited. Hi, everybody. Yay. Good to see everybody here today. Um,
Hey ho.
Douglas is, he might come, he might not. He is typically here, but he is out helping some of his neighbors. There was a fire and he needs to help with some electrical, and that's what you do is you help your neighbor. And so that's what he's doing. And of course, we're going to excuse him from being here because we love when people step in and help one another.
Yep.
Today, though, I have to share this incredible story. Uh, this patient called our Leg Saver hotline today, and it was crazy. A friend of his had watched our hangout a couple weeks ago, and she said, "Hey, I have a friend that is in Florida that has already had one amputation, and now the hospital wants to take the other leg, and he is still young. He's in his 40s. Is there any way that you can help?" And we started talking a little bit more about the symptoms and things like that. And she says, what's really funny is I kind of have some of those leg cramp symptoms. And I was like, um, so have you seen a doctor yet? And I was able to coordinate getting her in that week to go get a vascular examination. And lo and behold, she does have PAD and she is under vascular care now. And if you get diagnosed with PAD sooner rather than later, walking is, of course, the best medicine. But for her friend finally called our hotline today, and we are getting him in Friday to get his leg checked. He said it was interesting because his last consult with the vascular doctor, um, he had pulses in his foot, and he said, "Doctor, I don't understand. Why do I need to lose my leg? Isn't there anything else that I can do?" And the doctor said, "No, you're going to lose it at some point. You might as well get used to being bilateral amputee now." I just was floored. And so I got on the phone really quickly with another doctor who's going to review his case, and he's getting him in Friday. So stay tuned. But thank goodness we have the Leg Saver hotline that patients can call and get a second opinion to at least have someone else review the case. Never, ever, ever, unless your life is on the line, go straight to amputation until you get another opinion from a different doctor that may have different tools and techniques. So, anyway, that's my story for the day for the Leg Saver hotline, and, it's manned 24/7 so people can call. But I wanna say hello to everyone. Beth, right before we were coming on, you had a very interesting day that you were sharing, which um I don't know which one to start with. I mean, do we start with, the fact that you had this testing done and it takes patience waiting for
Uh,
the results? Or do we start with the whole type 1 diabetic thing and the fact that you learned a very valuable lesson today?
Well, I could always start with Thursday about having the other stroke, my second
Oh boy.
stroke in less than a year. Yeah. And then today I had my follow up with the ARNP from cardiology, and she kind of filled me in on some things. Excuse me. And what they are going to do. Well, she informed me that the stroke was on the left cerebellum, part of my brain, and that's the motor skills. What they're going to do is they're waiting for the insurance to approve a 30-day heart monitor because she
Oh,
said what?
interesting.
Yeah, they're trying to figure out if why I'm having the strokes because AFib causes strokes. Okay.
Ah,
So there could be a possibility that I could be an AFib and not realize it because a lot of people go to
interesting.
AFib and not realize that they are in AFib and could be having
Oh,
strokes. Okay. So this is why they are wanting to put a 30-day heart monitor on me to see if they can actually catch maybe a possibility that I'm going into AFib and not even realizing it.
And
Now,
throwing clots.
n-
Wow.
right now, if in the 30 days of me not wearing, or in the 30 days of me wearing this heart monitor, and it doesn't show in the 30 days of me having any AFib, then we're going to go a step farther. We're going to go in, well, we got to get this approved through my insurance, but it's about an inch to an inch and a half. It's called a loop recorder.
Okay. And they have
And
to embed that in there.
it'll be placed underneath the skin into my
Right.
chest, and it'll monitor me. The battery in the loop recorder is good for 4 years, and everything will be sent directly to my cardiologist's office. So,
Fantastic.
and because I have SVT, which is supraventricular tachycardia, where my heartbeat can get up to over 200 beats a minute, and because I have CAD and I have all these
Yeah.
other issues, and now I'm having multiple strokes and mini strokes and all this and that, they're hoping that maybe they can catch something that's going on in my heart that
Yeah.
could possibly be causing these strokes. So
And
that's
what's
what I
interesting
find
is that
out in the morning.
I'm so glad you must feel so much more cared for now with this and having what I like is that you have a nurse practitioner or your healthcare team that is saying here's plan A, and if plan A doesn't work, we do have a plan B. Now, that's not always the case. That's not always an option, but I think that it gives you hope and that, okay, we have a strategy here. We're going to get to the bottom of this, is really what it sounds like you walked away with. I am committed as your healthcare professional. I'm committed to getting to the bottom of this and helping to stop these strokes from happening. We've
Right,
talked in previous weeks about the fact, for those that may be listening, you're not on an anticoagulant right
right.
now,
That
that
was
you were
something else
taken
that was
off.
meant. Yes.
And
Um, that
that's
was something.
something
Yeah.
that if they do find that you have AFib and you are in fact throwing clots, that is something that we see quite a bit where doctor will prescribe an Eliquis or another anticoagulant to help stop that issue, stop the clots from
That was
happening.
mentioned also today.
Yeah,
More than likely, it would be Aliquis that's involved just because of the fact of
that's what they said.
transportation issues with the wharf, and there's no way. But I am no longer on the baby aspirin. I am on a full dose aspirin now
Yeah.
instead of the baby aspirin. So, but that's where that's at. So, yeah. But that's how my morning started. So that's
I
where
just
I'm
wanna
at with
say
that.
hello to quite a few other people that joined, and more feel free, everyone can just say who you are, and you can chime in and ask questions, and, I mean, it's a conversation. It was just we started because Beth got here, first, and so I found some of her information. Through her experiences, I've actually gotten messages from people saying, "Hey, it really helps me through her experience to learn the questions to ask my doctor." Um, especially for people who are also diabetic that might learn a valuable lesson from your second interesting experience today,
Oh,
Miss
yeah.
Beth.
So, it wasn't just today, but a couple, well, was it about a month ago, I had went, and I love chai tea. And so I had went to this Amish store here, and I'd gotten some
Oh,
powdered spicy chai tea from there.
yeah.
And I had made some, and not paying any attention to the ingredients in it. And I'm type 1 diabetic. I decided to make me a cup of hot, spicy chai tea. It was
Oh.
amazing, amazing. Well, Beth, hello, did not pay any attention to the first ingredients in it. The first ingredient was sugar. My sugars spiked to over 300
Oh, no. Oh,
immediately.
no.
and I had to fight like crazy to get my blood sugars down. And I'm on the Omnipod 5, if anybody knows what that is, and the Dexcom
Mm.
sensor. So it took me quite a while to get my blood sugars down, but I did get them down again. But I haven't had any spicy chai tea for quite a while, so I'm trying to find somebody to
Sorry.
take it. But
Yeah,
yeah,
me
it
something
was.
with no
I
sugar.
would do it again, but it was so yummy. But I just have to do a smaller amount, and this time I'd have to take insulin before I did it because I didn't take any, not realizing that there was that much sugar in that tea. But it was, yeah.
Beth,
I
you can
am,
make your own chai tea with cardamom seed pods.
what do you say, Imelda? With
You
what?
can, you can make your own chai tea with cardamom seed pods.
Oh, interesting. How do you do that?
Well,
Where do you get
I
that?
was I was in India, and they don't actually, the chai tea in India is just plain tea. They just call tea chai. But the chai tea that I've had is Good Earth brand chai tea. Is easy to make with just cardamom seed pods, black peppercorns, and black tea.
Yeah.
And then you just brew it
It's a good option.
and add
Yeah.
whatever you want for whatever you sweetener you can use. And if you like milk with it or something like that, you can add that yourself. That way you don't have to
Thanks,
put up with
Imelda.
it.
Yeah. Thank you for that information. That's interesting.
I love that.
How did you get your blood sugar down?
Omnipod, so all I just it and I have a Dexcom
Excellent.
sensor. And my
Yeah.
Dexcom sensor tells me what my blood sugar is. And I just punch a button and it gives me insulin for what my blood sugar is.
Oh, I see.
Mhm.
So yeah.
I was a type 2 diabetic for now I'm not. I was a type 2
Good.
diabetic
Bless your
and now I'm
heart.
not.
Yeah, it's so good. That must mean that at least with the type 2 diabetes, most are not insulin dependent. And there's so much that you can do with exercise and with diet that can bring it down without medication. But there are other medications that are available for people who do have type 2 and are really struggling with not only bringing their sugar down, but also with their
Yeah.
weight and particularly the semaglutides. We had Dr. Mark Banaka, who was the lead PI on the what was called the STRIDE trial for Ozempic, Wegovy are a couple examples of semaglutides. And they found that those medications literally improved walking distance, likely because of their ability to lower inflammation in the arteries. So I thought that that was actually kind of interesting. Um, but that is always an option to have a discussion with your doctor if you really struggle with getting the blood sugar down. But always check, and I think the lesson, Beth, is always check the ingredients list. I don't care if you're a diabetic or not. As we age, everyone is susceptible to having higher blood sugar. So there's hidden sugar in so many different foods. I
And
found
there
it
is.
in salt, right? Salt, iodized salt. A lot of them have dextrose sugar. I went and I was picking up some vegetables out of the freezer, and I didn't realize that a lot of these bagged frozen vegetables have sugar on them, or they'll have flour on them, or something, things that I personally I can't have. And so it's always good, just check the ingredients and try and just shop the perimeter of the supermarket as much as you can. Um,
Yeah.
fresh fruits, vegetables, natural grass-fed, no preservative meats if you eat meat kind of thing. But we should say hello. I think I saw Dawn is here. Maybe Dawn can turn her camera sideways. We could actually see her. Turn it horizontal. And then maybe we could get you.
I'm driving. I'm
Oh, and
driving,
she's
so
driving.
I don't really have anywhere to put it
Nope.
actually. So I have to put it down to use my hand. But I'm here.
Yay,
Dawn,
it's good to see
are
you,
you from
Dawn.
Boston? Dawn, are you from
And we have
Boston?
Bonnie who's here.
I didn't
And
hear
we
you. What did you
have
say?
Marie and
There.
Wanda. And Clay was telling us some good news as well about his wife. She went to the vascular doctor today or yesterday, was it, Clay?
Yes. They checked her legs and did the balloons on her legs and on her arms, checked her pulses everywhere. Had a little trouble on her right leg. That's where she's got her. She tore her Achilles
Oh,
years ago,
no.
and that pulse had a hard time finding it, but they found it. But the left leg, it was strong. It was extremely strong. But the doctor said that right now he considered it to be about 25%. She's standing at the moment. So every time she goes, she's improving. She's showing more improvement than she did time
And
before.
she's doing everything naturally, isn't she? She's doing walking and diet.
Oh my gosh, yeah. She walks every day with Nora on the property, and she does wee in the morning, and she goes out with her friends in town, and they spend she's gone 8 hours a day of shopping, getting out of the car and going places, and
Yeah.
she gets home and she vacuums, she does the windows, and she cleans the house, and she picks up after Nora and after me, and she just but walk, and build those collaterals and eat right,
For
don't
her.
smoke, don't drink, don't do this, don't do that. And the doctor, I can't remember his name. I'll have to call you and give him his name, but he was a chief vascular surgeon at the hospital the president goes to,
Oh, good.
Washington.
That's
And he was chief vascular surgeon for the United States Navy also. So
Wow.
and so
he actually doesn't
what I
operate anymore. But
but he helps her with conservative management, which is really the best for PAD, right? To slow the progression. He was pretty proud of her, is what my understanding was.
oh yeah, he was extremely proud of her. That every time she comes, it's an improvement. She's showing improvement, and the last thing any doctor wants to do is stenting, or even her other doctor before this one. It's the last thing I ever want to do, unless I have to, is do any stenting, because
Yeah.
a lot of times it fails, and from there it just it's not good. But what he said was that probably it's 65% of the patients he sees do not follow his recommendation, and then they
Yes.
wonder why they don't follow his recommendation, and it's a hard change to do when you're used to living a certain lifestyle, and just making that change. But same with the podiatrist. I did some work for him, and he said the same thing about
Yeah.
people with diabetes. They come to him, and he said he tells them what not to eat. And I started. Where'd everybody go? There we are.
Yep. We're
But
here.
he said that most of them come back and they usually have amputations on their toes and everything else, because they just don't do what they're supposed to do.
Yeah,
And
there's
that's
so
where a lot of
much.
people unfortunately fail. But
There's so
not
much.
easy for anybody to get up and
There's so
walk.
much that people can
The
do on their
PD walk.
own to improve their prognosis.
Right. I mean, the number one thing that I've ever heard, better than medicine, is walking. Walking. And if you got to stop, you stop for a few minutes. And then you don't have to walk a mile a day, but just baby steps. I mean, get up and walk the mailbox, and the next day walk a little bit further. And if his legs start getting sore, rest for a minute and keep on walking. The more you walk, the better it is for your capillaries or gosh,
Claudication.
for the veins
Not-
in your toe or stuff.
Not to
Yep.
cut you off, but some of us get to a point like me. I walked. I never stopped walking, but it got to a point where my legs got so bad, as much as I tried to walk, it prohibited me. Like I would have
Yeah.
to sit in a public place on the floor because I could not stand, because my legs were cramping so bad they would not hold me up anymore. So I
And you were
mean,
hypercoagulable. You right? You
Yeah,
you
I
were had blood
clotting up
clots.
all over the place in my legs. Yeah. So I mean, it does, like, you can walk, but it does get a point sometimes that you do have to go for an intervention.
Yeah, and
And
sometimes you
tried
need to make it in combination, right, with medication, making sure you're on the proper medication. We just had a patient story we shared today, and this patient went in and he had a bunch of procedures done. I think the wife said that he had 10 procedures done. and he just kept clotting, but he was not on maximum medication therapy. They didn't put him on anticoagulants, and that's what was causing his blockages were the clots. And this other doctor, when he was on deck for amputation, said, "Well, wait a minute, wait a minute, wait a minute. Let's try a heparin drip first." And then he went in and once he was stabilized, he did a little thrombolysis, just sucked some of the clot out, and then put him on maximum anticoagulant therapy, and he's been great ever since. But it's important that you're on the right anticoagulant or, the right blood thinner for your situation. And if you are a clotter, to make sure that you are talking to the doctor about that and say, "Hey, I want to stop this revolving door of blockages and procedures. Like, let's take a look at my cocktail, my medicine cocktail, and make sure I'm on the right one." And for Imelda, who's chiming in, heparin drip, it's a blood thinner that they put in, they can put in through an IV when you're in the hospital. Beth, what were you going to say?
Um, today at my cardiology appointment, she had mentioned also something about seeing a doctor about my.
Hematologist.
That's it. Yes, to see about how my
Good.
coagulation, or I
Yep,
can't. I'm not thinking right here. Help
you're
me out
fine
here.
with your coagulation.
Yes, and asked if I had
Yeah,
ever seen one of those doctors, and I've never seen
yeah,
one before. And she was saying something about possibly getting me in to see one because that would be a good
good.
step for me.
Yeah, no, that'd be great. And Marie, you were going to chime in.
I'm still to this day waiting for them to test me for that Plavix thing that you suggested like
Oh,
2 years ago.
so sometimes people, especially we see it sometimes in women. I think Dr. Anida Duwa, who is one of Dawn's doctors, right? Dawn, she's doing a lot of research on blood thinners and how the therapy should be individualized for people with PAD, and especially with women, that it's highly suggested that if Plavix, which is an antiplatelet, more like aspirin, right? Aspirin's an antiplatelet. If that's not working for you, then you should have a clopidogrel or Plavix sensitivity test to see if it's actually working. Because sometimes, um, the Plavix and there's a specific statin, they don't play nicely in the sandbox, and so you just have to make sure that it's working for you. And that's where you need to advocate for yourself, and you need to say, "Hey, doctor, let's revisit what we got going on here," and even get a second opinion and even a referral to a hematologist, to make sure that you are on the right medicine for your situation. And I don't know, Don, what you were on and if you were maximized, prior
So
to that.
I have never been on anything but warfarin, which is
Oh, so you were
Coumadin.
on the powerful stuff.
And I'm going to tell you why. So starting today, Dawn has to go on also Lovenox shots because for the past 2 weeks, the warfarin is not controlling my blood for some
Oh
reason. I
no.
think it's I think it's because I haven't. Today's my brother that killed himself's birthday, so if I
I'm so
cry,
sorry.
that's why. So I think the past like week and a half, I've kind of been depressed, but I wouldn't say like depressed where I'm not just shut down, but like I'm kind of not doing for my own self. I really haven't drank water. I'm kind of eating
Yeah.
ice cream. I'm eating candy. I'm drinking soda. It's diet, but I'm still drinking soda. I mean, I was down to a point I wasn't even touching soda anymore. I haven't been to the gym. I just kind of haven't been doing anything, but I can see the effect because now my blood is bad where I have to take high doses of Coumadin and stick myself now twice in the stomach for 4 days.
Oh, that's no fun.
Fix it. Yeah, I mean, but I will never, never, and even my hematologist and cardiologist both say the same thing. I will never come off warfarin. That will be the drug for the rest of my life as long as it stays working the way it should. I can't take any of the other medicine because my blood moves around too much and you have to really
Yeah.
monitor. So that's the only regimen that seems to work for me.
No, but it's been working for a while, so that's good. But
Almost
it's good
5
that you're
years. December will make 5 years that I've been on warfarin.
And what's great is that you do have that kind of that ability to know if you're not making the right the right choices for the moment. And it's good that you know exactly what's driving you to make the choices that aren't the best choices, for you so that you can make that change going forward. But it's
But
definitely
I mean,
understandable going through.
I'll come back around. It's just gonna take me. It's gonna take me a minute. I mean, yeah, I'm just kind of
Yeah,
going through it.
it's a
Like
lot.
it's his birthday this month. His death anniversary is
Yeah,
29 to 30 days right after this. Yeah, it's just, it's still hard.
it's a lot.
Still doesn't make any sense. But warfarin will always be the drug for me. We considered Eliquis, or like I said, the doctor said, oh, we'll come back and we'll think about other options. But I see what my numbers are every week. I see how they move. I see how certain lack of activity for me, lack of water, lack of watching what I eat can really affect me. So for me to ever go on any of those medicines is just asking for danger. That's how I feel. And the doctor agreed with me because I
Yeah.
advocate for myself. There's no way you're going to tell me I'm taking this medicine unless I tell you I'm taking this medicine. I do my research.
Yeah, but at least, you're being proactive about it. You're recognizing what's going on. And, sometimes, there are ebbs and flows in life. And at least in your situation right now, you have a solution, for the situation when you did, you know, take a dip there. And it's a lot to go through. I mean, you've just had so much going on. And, I'm glad that you also know what you need to do to at least make yourself feel better and get through instead of falling, deep into a depression. You got your nails done today, right? You took yourself out. You gave yourself a treat, which is good. That's a better alternative. Yeah, I could see your nails. She's showing her nails. It's a better alternative than eating the ice cream and such when it comes to, PAD. But we see Douglas is here. Douglas can probably pop up. He showed up and he's here, and so we can put you up on the
I,
big
I, I
screen.
was I
And
was coming in, but I got to meet April. I don't know if you've met April. She's in here with us now. She
Hi,
had
April.
just called the hotline.
Oh,
You know,
fantastic. Hi, April. And I see there's Nancy and I see Bonnie's new and Alan's here
Alan,
and Thomas, and it's great to see you. I saw the hotline
yeah.
ringing just a moment ago and then it stopped. So I'm glad that Douglas got it. And I thank you for calling in. And I can always call you back afterwards and we can discuss things in detail as well. But it's good to see you. We have another new one coming in here. We have Dean coming in here and joining us. So welcome to Dean as well. Um, we're just having a great conversation. We've been talking a lot just over the past little bit about one of the issues that many people have in blood clotting and the different issues, with that. And Clayton was sharing how his wife went to the vascular surgeon and he was saying he wished that more people would take their health into their own hands and do something that really works, which is walking. And there are some people, like Dawn was mentioning, that it doesn't quite work for her. Beth said it didn't quite work for her, and Maria didn't work for her because they are clotters, they're blood clotters, and they needed a little bit more, medicine therapy and a couple of procedures in there to suck out the clot in order for them to get back on their feet. So, different people, different presentations of disease, but it's really good for everybody to learn everyone's different experiences because there isn't a one size fits all when it comes to PAD. But for example, with Beth, who started off the conversation that many of you may have missed earlier, she's ended up with multiple strokes that she shared about. They're now looking at issues with her heart, potentially AFib. AFib is something that, maybe as we age, this irregular heartbeat, you can start throwing clots and end up, you may not have been a clotter, but suddenly you become a clotter. And that's something to get a handle on, but it's something to have a conversation with your doctor about because Blood clots are serious, and sometimes they can increase, the risk as we age.
And I
So
think so.
always make sure that you get to a cardiologist and have a deeper conversation if you have PAD, because 3 in 5 people who suffer a heart attack have PAD. So if you have PAD, it's likely you have some other things going on. So you need someone that can do a full check of your carotids, your heart, your abdomen, checking for abdomen, a potential aneurysm, as well as checking the pulses in your feet.
And a large part of that is
It-
right now is
wait
becoming
a-
the best advocates we can for ourselves.
Yeah.
And that's what I think
and
all of us
and
have
I'm
learned
one
a
of
lot
those.
about.
And Dawn is, yeah.
I'm an example of the doctor never checked my legs. So I feel like I had a heart attack at 35, lost my leg at, 6 years later. But maybe if
Yeah.
they took, when I had the heart attack and decided to take the time and check my legs, maybe we would still have a leg to this day. That's the way I look
Yeah.
at that, because the primary care, diabetes, never checked my feet. Feet were always cold, told me I was anemic. Legs always cramped, told me it was because I didn't get enough water. Nobody ever cared to check my legs until I finally couldn't walk and had to sit on the floor because they hurt so bad. And I'm so young that when I got them, checked, it was kind of too
Yeah.
late, because I had a blood condition that we didn't know about, blood clotting condition. So, I mean, the blood clotting condition, I think losing my leg for me was a blessing in disguise, because I think, to be honest, I was going to be like Beth, throwing little clots, because that's what was happening in my body. It was getting all these little clots. And eventually one of them was going to take off and probably give me a stroke. I started to have a stroke when they were trying to save my leg. So I had to decide, was it going to be my leg, or were they going to try to keep giving me the medicine that was giving me a stroke? So
Oh,
it
no.
See, when
became,
mine all started, my primary thought it was my back. And for like 3-4 years, I was
Oh,
on
wow.
Flexerol and naproxen. He just kept saying it was my back. It was my back. Until one day, my husband came home, found me in a fetal position in the shower bawling because the cramps were so severe. And he carried me to the car, got me to the ER. They thought I was a drug seeker. So after like 4 hours in the waiting room, they finally took me back. And as soon as the doctor walked in, he knew right away. He grabbed my leg, felt it, told them to get pain meds into me. And they took me where they did the test for the dye, where they shoot
Yep,
the
the
dye in.
CT. Yep, CT
And as
angiogram.
soon as they did that, they called an ambulance, and I didn't even leave the room. They did the test. The ambulance came in that room, loaded me up, and took me lights and siren to Flint. And I didn't stop. I
Wow.
didn't say go, nothing. They took me straight into the OR. I woke up the next day, and my husband told me that the surgeon told him, first, I'll try to save her life. If I can save her life, then I'll try to save her leg. They said I was within hours of being dead.
You're kidding.
Yep, that I left that primary as soon as I left the hospital. I got a new primary because all he had to do was take the time to check my legs.
Well, that's
And how
Okay,
many
that's what I
stories?
have to do. I have to call my doctor constantly. Aren't you gonna do this? And no, we're not gonna do that. We don't think anything serious yet. I had
That's their
50%.
famous last words.
Yeah. And
So
and you know what?
Bonnie,
Don't ever think you're a pain either. You keep calling. If you feel
you
like
keep
there's
calling.
something wrong,
I
you keep
yeah, and
on
I can't
calling, because you
walk.
know what? 99.9% of the time, you're right, and there is something wrong. And it's
Yep, they
not
work
that
Yeah.
they
for
don't
you.
care, they don't have the time, and some of them do think they know everything because they are doctors. But you know your body. You know how you feel every day. You know that it's not normal to be breathing like this, or feeling this cramp, or can't walk like you usually walk. You
No, I
just
can't
keep on
walk.
advocating. You tell them
Uh,
that, you know what I mean? You tell them that this still aches. You need to look into it. I don't want to hear it's not a bother yet. It's bothering me now.
right.
You
Good
Yep.
need to
advice.
look into
Yeah.
it.
And
I
Bonnie,
can't
so
walk
what
for the reason because I
Don't wait
have,
till it is a problem. Take care of it now.
Okay,
yeah.
well, can you
So
take care of it?
Bonnie,
That's what I
Bonnie,
want
what
to. How do
so
you?
are you seeing a vascular doctor right now? Are you getting care? Are
I
they willing to
did
do something for you?
go and he sent me to back to Fergus from Fargo.
Okay.
And then he switched me because I couldn't go walking. It's due to my IT band. I had surgery on it. They had to lengthen it. Well, now it has shrunk again, and I've been in PT for I don't know, going on my second 6 weeks, and I'll end up going 3, 4, 5 months. Today I decided I want to try the soft wave. Maybe that'll help me heal, even though it's an old wound. It's a fairly new
So you have
product.
yours are issues that are not related to vascular right now.
No, he said I had, well, I don't know. I'm 50%
Oh,
clogged,
okay.
or claudication, but I never did have the pain walking, you know, in my calves or my toes.
Okay.
I had pain in my thighs, but when I started physical therapy, that went away.
Okay, well that's a good sign for that. But you still should always just make sure that you stay on top of the vascular and make sure. It's really tough sometimes to know because there's so many different things that can mimic PAD. It could be
Yep.
arthritis, it could be back issues, it could be sciatica, it could be on and
Correct.
on and on. We just had a patient that had his piriformis that was having issues and it wasn't, vascular. And so but it's really important because back issues and sciatica are literally the number one misdiagnosis that patients across our network are reporting, that
Yeah.
the doctor said, oh, your issues are back related. We've had people that have had spinal fusions and that didn't solve their problem. So it's really important to make sure that if you are having these back issues, you're not finding resolve, that you do have a vascular assessment, especially if you
Well,
have
I
those
did
risk
have that. I
factors.
mean, they said I had PAD. The
Yeah.
doctor did say that, but
But they can typically tell if the, symptoms are, if it's 50%, it may not be if you're having the symptoms have to match the imaging, right?
correct.
And if the symptoms are not quite matching the imaging with, 50%, usually depending on where the blockages are, if it's debilitating pain, typically it's the percentage that we've seen and we hear from doctors is it's a lot higher of a percentage. But it's always worth a second opinion. It's worth having those scans redone and have someone else look at them just to make sure because we've had a patient that we helped through the Leg Saver hotline, and the doctor said, "No, we don't see anything in the CT angiogram. Everything looks fine." But her symptoms weren't matching the imaging. And so this doctor, he was a vascular. He said, "I just have a feeling, Kim." He said, "Come down, you got to see this. I just have a really strong feeling about this patient." So I met the patient there, actually got to be in the procedure with the patient and the doctor. And he said, okay, take a look at the CT angiogram. He pumped in not the CT angiogram. He said he pumped in the contrast fluid. He lit up the fluoroscopy and you could see that it looks like blood flow was going through. He said, now watch. And he took a device called IVUS, intravascular ultrasound, which uses audio waves to give them more of a 3D image. And he put it in there and the patient had a 98% blockage in their iliac artery in their groin, and it would just happen to be the angle that
Oh,
the fluoroscopy was capturing that showed that there was nothing. And as soon as he took a little wire and a balloon in there, and he did a little lithotripsy, which is the audio waves to crack the plaque, the patient felt immediate relief in her leg when she got up and she was walking after the
huh.
procedure, and it
I
was
never,
like a miracle. So you really do
wow.
have to advocate for yourself. You really need to explore, the options. Make sure that the symptoms, match the imaging, and make sure that you're exhausting all efforts. If the PT wasn't working for you, then I would say, you might want to get a reassessment and just double check. But I'm glad that the
Right.
PT is working for you. And I see
Yeah,
that
I think
Nancy
the
wanted to
shock.
say something.
Yeah,
Nancy wanted to say something. Go
I
ahead,
well, I have a
Nancy.
question. Hi.
Sure.
I'm so
Hi.
glad I found this group. So I have a
Yay.
couple of questions because I'm brand new to this as of May or June. So I'm wondering, should I be asking for a clotting test, or is that when something unusual happens when you're walking more than what seems to be the norm? Like I walk and then I get very bad claudication and then I stop, and the stopping is even more painful, I think, than the walking for a while. And then I continue walking, and I've been doing that, I'd say 6 days a week. I don't feel like
Good
I'm
for you.
getting better yet.
Oh, no.
um
So the question, I think that if we can rephrase it, the question that when someone says you have PAD, the question to ask the doctor is, why do I have PAD? Is it, what are the risk factors? Is it because my
And my
blood sugar
daddy's
is
fault.
high? What is it?
I said it's my daddy's fault.
Oh, it's your poor daddy. We love daddy.
Yeah, but I got it from
We love
him.
dad and we love mom. I love both of them. No talking mean about them. But yeah, it could be, she brings up a good point. Is it hereditary? But why is it hereditary? Is it because there is some sort of like Deion Sanders, famous football coach, former NFL player? Is it because he had, his family has always had these clotting problems, so he's hypercoagulable? If that is a reason, it's worth going to a hematologist and saying, I need to be tested for some sort of hereditary clotting disorder. Do I have protein S, factor 5 Leiden, factor 11? Do I have what's called MTHFR, the mother effer gene? That's something that I have, my dad has, my brother has, and that can also lead to blood clots.
Lipoprotein little a.
It can be LP little a, exactly. So there are a lot of different reasons. It could be autoimmune conditions. We've had several patients that have had issues with COVID or COVID vaccines and became hypercoagulable. We've had people who have smoked. Traditionally, that's been one of the biggest risk factors. Chronic kidney disease, that can also be an issue. That can lead to really heavy calcium below your knees, just like in diabetes. So it's really good to have that heart to heart with your doctor. And if they say to you, oh, you just have PAD, I don't know what it is, it's just
well, yeah,
atherosclerosis,
they were like, well,
you
it's your
need to
age, and
dig
I
deeper.
just, yeah, I was told, well, it's your age, and now I have coronary artery disease, which with low cholesterol, I didn't know that I had that either. um but so, people have kind of been writing me off just based on my
Yeah.
age.
So it's time to get a second
Don't let them
opinion.
do that.
We can always
Yeah,
help
you
with
don't let
that.
them write you off.
And that's what we've been working with, with Marie here as well, is getting that second opinion and finding someone that will sit down with you and map it out. It's really, really important that you do get to the heart of it, because, for example, with the MTHFR mutation, it it literally makes it so that your body's not turning food into fuel. And the American Heart Association, it's such a
Mm,
big issue that it is on their website as something that should be tested for, because that can
interesting.
lead to atherosclerosis. Because if you're not turning food into fuel, your B vitamins aren't absorbing properly, and ultimately this one enzyme called homocysteine is running
Right.
rampant in your arteries. It's not getting broken down, and it's like nails on your artery walls. And if there's damage to your artery walls, then these little LDLs can sneak on in, and they can push the artery wall out and lead to a shutdown of that artery. So it's really
Mm.
important that you do get to the bottom of it, because, for example, with my dad, heart disease did run in the family, but his family had a history of this MTHFR mutation. And once we were able to get that under control with a methylated B vitamin, prescription strength, called Mechanics. And we got him off all enriched flour products. The damage was, was not continuing to get done to his arteries. So he was improving. So find out what is
Who
damaging
do
my
I,
artery
who,
walls. Is
who
it
would be the
inflammation?
person to do this with? Is it the cardiologist, the vascular
Cardiologist is
surgeon?
great.
Yeah, it's very
What is?
Yeah,
frustrating.
the cardiologist is fantastic. Usually a general cardiologist can help you and have more time with you and sit and get down to it. Also, vascular surgeons and interventional cardiologists and some
Okay.
internal medicine doctors can also have an extra credential called vascular medicine. So it's
Okay.
worth asking to see if you have a vascular medicine doctor that is in your network that you can go see, and they're more than happy to have these conversations with you. Not a lot of
Okay,
people
great.
know about vascular medicine doctors.
You
So
should get a
that
hold
that would
of
be a really
Kim or
great
Doug
direction.
later and tell them where you're at, and they can find you one that's best, that's where, right where you're at. They'll find you the right one to go to.
Yeah.
Where did you say? I was writing something down? Just,
So if you call the Lake Saver hotline up here
oh, okay,
after the
great.
broadcast, we can get on the phone with you and we can find out where you're located
Okay,
and
great.
see if
Thank
there's
you.
a person, yeah, that's right there near you. These doctors absolutely love getting to the heart of what's going on, because if you can find the root cause, with PAD especially, there's so much you can do to slow or even stall the progression of disease.
And
And so it's just a matter of, doing a little detective work.
Okay,
And,
I'm gonna
great.
we all
call him
get
too.
plaque in our arteries as we age, but
y'all
there's
think
something
about
else
this.
going on.
Think about this also. 10 years ago, 20 years ago, 30 years ago, they didn't have the techniques they do today. You'd be surprised at what they
Yeah.
have today to be able to help us. And each of us have different symptoms and in different ways doctors can do what they do today because they have
Yeah.
amazing stuff out there now that can do things that
Yeah.
we would have never dreamed of doing 10 years ago to help us.
Yeah. And April, you have your hand raised. Nice to meet you. So great seeing you here.
Thanks. I've been lurking in the group for a while since my dad was diagnosed in, he's had kind of a fast escalation, a really long ramp towards the
Oh no.
diagnosis. But since
Yeah.
then, everything's lit like a wildfire. Anyway, my specific question, my hand was up because of, you mentioned homocysteine. He takes a homocysteine regulator. I'm very certain he has MTHFR and he's not utilizing his B vitamins and he's clueless. And because of the exhaustion with the place that we're at, there's no capacity to educate on these new topics that are so complex. MTHFR is just not something that's digestible in a day. And, there's no short snippet to really get a person up to speed on that. It just takes time to process what that all is, how it impacts you specifically. That's get tested to see what yours specifically means. And so you mentioned after I raised my hand, no enriched flour. He's
We
been
do have
given
a
poor
book.
advice and he's been told just to eat whatever he wants because he needs to gain weight because fighting the gangrene has really caused a lot of muscle consumption and he's
Yeah.
lost gobs of weight because of it. And so he's weak
Have they
and so he
talked
needs to
about
gain.
Juven, Juven by Abbott? That's
Yeah, they
something
put
that
it
they
on his
use.
plate a couple of times in the hospital, and he read the ingredients and didn't like what they
Didn't
were
like it.
and turned it
Okay.
away. But yeah, that's predominantly protein, right?
Hmm.
Okay,
But
I'll
when
remind
it
him to
comes to
look
the
into that. But
MTHFR, on our YouTube channel, youtube.com/the @ the way to my heart, we have our nurse practitioner, Deidre Arms, who it comes on weekly and she offers information about supplements and food and things like that. And we spent an entire episode talking about MTHFR and methylated B vitamins. And so it might be something that you can search on our YouTube
okay,
channel for, or we can find it for you. It's also, we did a few pages with another friend of ours, nurse practitioner Kay, and we put together a few pages in our book that you
I
can get on
saw.
Amazon. It's called Food for Thought. You just search peripheral artery disease and you can get the book. But we also have a digital version, which is free. And so
Okay.
I can always send you a link for that. And so when we talk
Okay.
later on the hotline, I can send you links to some of those things so that you can just breeze right through them. And I think that we've simplified it enough because I just simplified it for myself and I wanted to understand it. And I can tell
Okay.
you that methylated B vitamin, the Metanix, it made the biggest difference for my dad.
Oh,
I mean, huge difference.
Yeah, he's taking
So,
this homocysteine modulator, and I really think, and he's been taking it for forever, long, 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 long time. But he
yeah,
says, "Oh, my B vitamins are off the chart if I have," and I'm like, "It's because you're not using them." And I don't know how to communicate that to him. Like his body is just piling up, and it's actually
yeah.
causing damage. It's not helping, and I don't know how to communicate that. And so I got him to step back on those a little bit because they're unmethylated. But getting him to change is difficult. So Metanix, but we
Uh,
need that prescribed.
you do. But it sounds
Okay.
like the doctor already has him on something that should work if he would actually take it.
Which is, what are you hearing?
You said you have some sort of homocysteine
Oh, it's
modulator,
just an
some sort of.
OTC. It's just something, I think it's Solgar or some other supplement brand.
Okay. If it was something that was recommended, I mean, there are some over-the-counter ones that are pretty effective. They were effective for my dad, the liposomal and the drops. And I took it actually, my everything went back to normal. They wanted to test to see if my blood work was just a little bit off because I hadn't taken my B vitamins. And so when I saw the blood work, I was like, oh my gosh, I need to take my B vitamins. And she had ordered the additional test for the homocysteine. Everything seemed back to normal. And she said, come on, you doubled down on those B vitamins, didn't you, in the past week? I said, yes. So it screwed up all the stuff. But the B vitamins are really key. That's also great for cognitive function as well. If you look up B12, there's so many different things that if you're deficient in, it can wreak havoc in your body. So it's really important to make sure that he is taking that. Can I ask you what city and state without.
We're in central Indiana. Indianapolis is where we're getting most of the care.
Oh my
oh,
goodness, easy breezy. We have
I mean,
great doctors in Indianapolis.
yeah, it's not
That whole
been
area.
easy. It's a drive for us, but it is accessible. So that does help. And yeah, I'm
You have
open to hearing
great
the doctors you
doctors
have in
throughout.
Indianapolis to see if they're different than the two Indianapolis vascular surgeons that he's been with. But
Yeah, we can, if he wants a second opinion or third opinion, we can
okay,
always help with that. And we can also just help with better questions,
yeah,
to ask the doctors to ensure that sometimes it is just asking the right questions that you get the right answers when you're talking to the doctor.
yeah,
They don't have a lot of time. They have a lot of different
right.
patients.
I'm not
And
allowed in the
so,
room. He's a good advocate for himself, but he doesn't like me to participate. I'm the Uber. So I have to do everything through the back door here by drop something in his ear and hope he does something with it inside the room. It's a challenging situation for sure.
that is very challenging because you do need, it'd be great if the Leg Saver hotline could be just placed by his phone
We
to
also
see if he
have,
would actually give it a call. You know, and we
in
could talk to him, but we can help educate you on quite a few things.
Yeah, the
And
liposomal drops, and we can talk about that when we talk on the phone. But I
and
would like some
actually,
information on that more.
one of the doctors that we work with in Indianapolis, patients nominated him for I think it's a Compassion and Care Award
Oh,
or
wow.
something. So I have to go back and look. So he is actually going to be live sometime in the next 2 to 3 weeks, and you can end up having him watch it with you when it's live, and you can say, hey, just let me know if you have any questions for this doctor. He's right in our area.
He may not make it
And
that long before amputation. It's imminent. at this point. So that's why I think we need to talk to see. He
So
may
when
not
you
be able to
talk
wait
about
till the,
amputation being imminent, number one, I mean, if patients have out of control pain and the doctor's not able to open up the vessels, if the
he's been
gangrene
reopened, but
turns
the
wet,
gangrene has turned from dry to wet.
if it's wet, that is life threatening. That just needs to happen. That just,
Right.
you don't pass go. It's just a matter of at that point, how much needs to go, right?
Yeah, we're
Is
below the
it
knee right now. Thankfully, it's that up until this week, we thought it was going to be a transmetatarsal.
transmetatarsal?
We
So the
thought we could do that,
transmetatarsal,
but there's a wound on his shin that's just not gonna comply with transmetatarsal. He's gonna have to go above that wound.
yeah, if it's infected and they can't do it. Now, if the wound is not infected yet, and it is
It is,
possible to
I think.
open up, it is,
I
it
think
might
so. I
be,
haven't seen the shin, and I don't want to monopolize this forum. We can talk more specific later, but
yeah. But
I
it's
have,
important for people to know wet gangrene is serious, and I'm not sure
yeah.
if he's
He's
at
been able to
home.
keep it dry forever, and then all of a sudden, 10 days post-op, I mean, he went in for his first revascularization attempt in June, ended up being given cabbage by a four-way bypass instead, and
He's had a lot
has
going
held
on.
on until approximately 10 days ago. Well, the 4th. He had surgery
Yeah.
on the 4th, and that was his revascularization. And then he's been dry gangrene all along, but then apparently now his 1.5 week post-op was told it's now wet, and
I
there's
would
no,
imagine he's in the hospital then.
he's back home.
I would double check on that. I mean, if it, from my understanding, if you have wet gangrene, that you don't mess with that. It's don't pass go. So I would
That was what I thought
definitely
too.
double check.
Yeah,
So
but they
if it is
bandaged
in
Can
his
I
fact
twisted.
wet,
ask you a question? Can I ask you a question? Is that
hi
what
Dawn.
happened to me? My foot went gangrene, right? And what meant they had to watch for? Is that when the gases begin to take away the tissue? Isn't that what
That's when the
happens?
gases
That
start
when you
releasing.
touch it,
Yeah, it starts
that's what
releasing
happened
into
to
your
me.
bloodstream, and that's dangerous.
Mm.
Yeah,
It's
mine
it's
happened.
it's just
Yeah,
And they told me that was the decision I had to come to. I had to lay there in the bed, and he came to me and he said, the gangrene is now wet, which means the gases will travel and take the rest of your leg. He said, so if you ever want to walk, we have to make the decision now. Well, he said, didn't
that's
say now. I turned to him, well, can I wait till the morning? And he looked at me funny. And I said, well, what would you do if it was your leg? He said, I would take it off now, because the longer you wait, when it's wet, you could end up losing.
if it is in fact
That's what I learned.
wet, right, Dawn? Yeah, I mean, if it is in
I'm
fact
so
wet, I
confused
would
by this
double
too,
check.
because that surgeon that said it was wet, that was Monday, gave him a medicated wrap and sent him back home an hour away with me, and then said, don't take this off for 5 days, lathered it with medication, which would make it more wet. It was, I don't get it. And then, yeah, and said, unless this gets wet, then take it off. But it was a compression wrapped bandage, and it just seemed like such a change from what we had been told, because now I had this moisture slathered all over it. So,
That's very odd. I don't, I would
and I
definitely,
mean, then he
we'll
went
talk right
to,
after this
yeah,
because
he went to a podiatrist the next day, and the podiatrist didn't send him to the hospital either, and said, yeah, I mean, I agree, this is the right place to, your next step is amputation. And yeah, so
yeah, I'm
The
not.
importance of getting a second opinion and
yeah,
being
It's
well,
wet
the
informed.
surgeon that did the
gangrene.
revascularization was a second opinion.
Wet gangrene is a medical emergency.
Yeah,
And I
I'm
mean, we're
really
not,
surprised. I don't know. I'm not allowed in the room. I'm not allowed to ask
I would,
questions.
I would read the notes, see if you can get a look at his notes, in the
I'm not allowed in.
portal. Yeah.
He's
Okay.
very
We'll
capable.
definitely, We'll
but
definitely talk after this because
okay.
it is difficult if you can't if your dad, and we see this a lot, if your dad's not listening to you and you can't take the action that you need
Right.
because you don't have any sort of power of attorney. He's right of mind. He's making his
Yes.
own decisions, and that's really tough. We've had um, decisions that were made that the kids just couldn't do anything about, or a sister or brother couldn't do anything about. There was a patient that was in a hospital in, goodness, where was it? I think it was in North Carolina somewhere. No, it was in Ohio. And the doctor never even tried to open up the arteries. Never even the patient actually just had a toe that was gangrenous. They could have, it wasn't even wet gangrene. The doctor said, you know what, you're going to lose your leg anyway at some point because that's just the way it goes with this disease. So we might as well take your entire leg now. You're young,
Yeah.
you can get used to it, no big deal. And the sister who wasn't there, they had two sisters that were there with this patient at the hospital. The other sister who felt she couldn't do anything, she was like, I can't do anything except go online and call you and see what to do. And we ended up, I gave her the information, told them that they should have a vascular evaluation first, make sure to ask for a CT angiogram, see if it's truly necessary, see um, if it's a circulation issue. And it was just too bad that the two sisters that were there and the patient were like, well, what the doctor says we'll just do, and the doctor's right, and we don't want to make the doctor upset, is what one of the sisters said. We don't want to make the doctor upset, so let's just let him take the
I
entire
I
leg.
wish
No
And then,
way.
and
I
then
And
wish
on
they
top
would
so,
of
talk
that,
to me because I would have told them how life is with no leg because it's
yep.
not as
Wow.
hunky dory as you think it is. Because oh yeah,
And
you're
it
gonna walk, still not walk. Like I mean, most of it now for me is by choice. I don't walk because it was too difficult, and for my life, I can't put it on hold. But I really wish that I could get to somebody after a doctor says, "Let's just take your leg." Because I would like to show them what life is with no leg and having
yeah.
to still live life and take care of responsibility. It's definitely not what these doctors think. Definitely not. It's not easy. So if you can keep those legs, keep them legs. All I have to
Yeah.
say.
It's
Because
worth,
being
I
an
mean,
amputee,
before you make
it's
an
not easy.
irreversible,
Mm.
one of the doctors who's our PAD doctor of the year, Dr. Nicholas Muad, was on just the other day, and he said, before you make an irreversible decision, make sure that you've exhausted all efforts. If life is not on the line, make sure that you do, get your second and third opinions. A story we just shared this week, it was the when we got on the phone with the vascular surgeon, was his life on the line? No. Um, could he do something? Well, he could have tried a bypass, but the bypass he didn't think was durable. But it wasn't necessary right away because once we asked him about, well, do you want to try him on he's a clotter. Do you want to try him on a heparin drip first and see if it improves since it's not completely acute and life is not on the line? And he tried it and we got a warm foot again. And it was enough to be able to say, hey, you know what? We want to get a second opinion as long as you don't feel like his life is threatened right now. He just was saying the same thing. Why delay the inevitable? At some point, you're going to need this amputation because you're just going to clot back up. But he said, but not right now, right? I can go get a second opinion. And he found a different doctor, different hospital that it turns out that they didn't have him on maximum, anticoagulation therapy when they sent him home before. So now he is, and he's doing absolutely amazing. So it's really important to make sure before you do have an amputation that life isn't on the line and that it is, in fact, it might be their only option. It might be your doctor's only option.
Hi.
But what if it's not someone
I'm on a
else's,
Zoom meeting
another
right now.
doctor's option, right? So it's worth just double checking. And the doctors are trying to do the best they can. They really are, but some may not know what they don't know. They just may not know that there's something called a deep vein arterialization, where they can hijack a vein in your calf and reroute blood flow into your foot if there's no arterial flow. They just may not know. Some of the technologies are just slow to roll out.
Yeah.
So it's worth just getting another opinion. So,
I look
but
forward to hearing more
definitely
as we
April,
talk.
we should not, I didn't say hello to, oh, we have Alan and hello, Dean.
Hello, Kim.
Hello there.
Where are you from?
Can you guys hear me?
We can hear you.
Yeah.
You sound
Okay, perfect. I'm just making sure. I'm from South Africa. I am,
fantastic.
yes, I'm, Rachel. She's the one from Patient Pro Marketing. I
Oh
actually
yeah.
have an
Oh, you're the
interview.
Dean. Oh, you're
Yeah,
Dean.
that's who yes, that's me.
So we're hanging out on
So
Friday.
yeah, exactly. So we're having an interview together on Friday. And
Oh,
so I'm
fantastic.
Yeah, so I'm actually new to P.A.D. Hence why I'm trying to get as much exposure to what everyone is actually dealing with. I'm basically the P.A.D. outreach manager for our company. And so I'm going to be doing what clinics can't do, is basically reach out to patients. And basically because a lot of clinics forget about their patients to reach out and
Yep.
to follow-ups and stuff like that. So
Who
our
agrees?
our job, our role is to try and reach back out to patients that's otherwise been forgotten and lost in the cracks, and basically find out, let's do a screening. Let's make sure that there's nothing else going on, and just make sure that we can stay on top of their healthcare.
Yeah,
Um,
that's
and
great.
so
And
that's
so
basically what I'm doing.
yeah, we're gonna hopefully, we're gonna hopefully join forces on a lot of different things, and even would love as we go along, with these weekly hangouts to invite a lot of those patients to come and join, and you can join the conversations. They also get to know you as well, maybe a little bit better as we go along. But it's really a great opportunity for everyone to chit chat and learn and share experiences. I will need to, just on the side, I'll need to move the meeting just a little bit further, because on Friday we have actually Dr. JD Coral, who is from from Christ Hospital, I think it is, in Cincinnati. He is another Global P.A.D. Impact Award winner, and he was supposed to come on today, and he had to go save some piggies. And so he asked if he could move his interview and award presentation to Friday at 12:15 Eastern time. And so what a doctor wants, a doctor gets.
Mm,
And so
that's fine.
I just found out today that he had to move. So we'll figure that out. But it's great to have you. You're always welcome.
Thank you.
And Alan is here from Canada. I'm so
Yes.
glad to see you, Alan. You don't join us enough in this Wednesday forum, but we like having you.
I for the last few months, I just haven't been very well, so I
Yeah,
haven't been on much. And I don't know, I get busy. I had a busy day
you do.
today,
But I
and that's
like when you're busy. I like when you're busy.
yes, yes,
That's a
that's
good
not a
thing.
yeah, it is. It is. I'm starting to do normal things again, and like have
Yay.
lunch with friends and
Oh,
go
good.
shopping, and so
Are
it's
you
good.
using your walking pad yet?
Yes, I am. I
Good
like it.
deal.
Yeah. I
I love it.
yeah, there's some days when maybe you just don't feel like going out, and so I'll get some steps in on the walking pad, or
Good for you.
at the end of the day, maybe after dinner, I look at my phone and I say to myself, gee, I wish I'd walked another 2,000 steps. So I'll get on my walking pad and put those on. And I think everyone should have one of these things. They're so
Oh,
cheap.
it's the best. It's the
Yeah,
best.
they really
I
don't
have one
cost
right
very
here.
much. Yeah,
No, and I have a tip for you. I have a really good tip.
but
So I didn't know there was such a thing um as an overstock for Amazon. And I guess most areas have an Amazon overstock dealer. And so when they have the big plates that come in and maybe one was damaged, or maybe the shipment came in late and now Amazon doesn't have room in the warehouse, whatever the reason, there are a million different reasons. And this overstock dealer ends up with a bunch of whatever it is. And
yeah.
when I was looking for a walking pad, because I just got my stand up desk because I have to practice what I preach. So I got a stand up desk because I was on my butt all day long. And I was looking for my walking pad. I couldn't figure them out on Amazon. It was so hard to understand the reviews and figure out which reviews were bought and paid for and real versus not. And
Yeah.
I just couldn't figure it out. And I ended up going on, one of my friends tipped me off to go on to not next door, Facebook Marketplace. And so I went on to Facebook Marketplace and I saw that they had them at really low cost. I was thinking, well, that's kind of weird. They have a variety of them at this one little shop, and they all seem to be about the same price. So
Yeah.
I asked a friend of mine to drive with me up to where this location of where this person was. And that's what he was telling us, is he is an overstock dealer. And just as we were pulling up, an Amazon truck was coming around the back to deliver to him all of these different things. And he ended up with a huge shipment of walking pads. And
Oh,
I said, well, this is the one I was looking at. And he said, no, actually, I would get this one. And it was the $400 walking pad. He gave it to me for 75 bucks.
Oh my God.
wow. Wow.
Wow.
So take a look and see if there's one of those. And you can usually find them through like Facebook Marketplace or eBay or something like that. Make sure it's legit. Make sure don't give them any money and I didn't have to give them any money until I got there.
Yeah.
So it made it really easy. I just got the cash and I went up there and I made sure that it was legit
Yeah.
before I
That's
did it.
great.
So just a little tip.
Yeah. Yeah.
Wow.
Good to know. I paid would have been US about,
Them out to save my life. I mean, honestly. So if you have one that's really working for you, it'd be
yeah.
great to share that in the group.
Yeah. Yeah. I should. You're right.
And I think Douglas is even looking to get one, aren't you, Douglas? Once you get your mini house built?
Yes, ma'am.
Yeah. Douglas sent me a message asking what I had.
Oh,
He's looking for one. But yeah, I use mine almost every day now.
I'd love to get one. I might have to
Yeah.
look into.
Yeah.
hello,
It's
Beth. Did I not get you one? What?
I got the treadmill.
I got you a treadmill.
Yeah,
Where's your treadmill? I'm gonna put you on the spot.
it's in the big bedroom.
So that's the
I
same
haven't
thing
tried.
as a walking pad.
Oh,
yeah.
okay.
Yeah.
Yeah,
Yeah.
I still have it.
If you've got a treadmill, you don't need a walking pad.
Nope.
Okay.
It's a lot safer. Um, unless make sure you have the bars. Mine doesn't, so I hold on to the desk in front of me.
Well,
Okay.
mine doesn't have the bars, and I have it right beside a window where there's the frame comes down, and I can put my hand on that frame to steady myself if I'm feeling a little unsteady.
Good for you.
Yeah.
Because especially with PAD, your gait can be off, so it can
Yeah.
affect your gait. So it's really important to make sure that you have some stability. I've even almost fallen off my
Yeah.
my treadmill without it, thinking I was getting a little cocky. I'm gonna go hands free,
Yes.
and
Yes.
yeah,
I've
no, don't do
tried
that.
that. I've tried that on the one you got me, and it's like, oops, nope, hold on. And it's self-motivated, it's self-propelled, it only goes if I go. So,
Hmm. I
yeah,
did that
and
deliberately. I know it's a lot harder, but
it is.
it makes you work. It really makes you work.
It
Is yours
does because it's got an incline to it. Mine's got an incline. So what I've done is I've gotten a 4x4 piece of wood and I put it at the back end of it to level it out to make it more level.
it's called cheatery. That's called
Hey, it's
cheatery,
easier to
Miss
walk
Beth.
level than it is at an incline. I ain't ready to
But at
walk the
least you're using.
mountains yet.
Yeah, we're not like VJ in the group that climbs mountains. Get ready for her story coming out,
Oh,
either this week or next week. Oh my gosh. She went from lifestyle limiting claudication and on her butt all day long and
she's
smoking, and
amazing.
now she's climbing mountains,
Wow.
which
She's
is
amazing.
I know, but it shows you what's possible through walking as medicine, right?
Yep. She's never had no procedures, nothing.
Oh, except as both you and Dawn and I don't see Marie mentioned earlier that if there is some sort of clotting situation going on, sometimes that is not going to stall progression. That if you are walking, you are doing everything you need to do, and your
Oh,
symptoms are getting worse despite walking, it's something that you do need to make sure to get a reevaluation with your doctor,
yeah.
because you might have something else going on. So that's
I
really
know when I
important.
was in the hospital Thursday and Friday, doctors kept asking me, "Are you sure you're taking your Plavix and baby aspirin? Are you sure you're taking your medicines every day? Are you sure you're doing this? Are you sure you're
Mhm.
doing that?" Yes, I am faithful about taking my medicines. I do not miss my medicines, you know. Yes,
And that's
so I don't understand why I'm getting these clots like I am in my brain that's causing me to have these strokes. So it's
yeah.
frustrating because I am faithful about taking my medicines.
I'm going to send you the video that Dr. Anita Dua did with us on the difference between antiplatelet and anticoagulation therapy and why sometimes you need dual therapy. And I think that it could be very useful for you. She explains it really well. It wouldn't be fair for me to share to explain. I think she does a much better job, and since she's clinical, I think that she's most appropriate to share that with you. But I think that you'll appreciate and understand why you may be continuing to clot, even though you're on this heavy antiplatelet therapy. And also, like Marie, I don't know where Marie jumped off, but she brought up a good point as well that do you have Plavix sensitivity? I mean, is the Plavix working in your body in particular? Are you on a particular statin that the Plavix may not play nice with in the sandbox?
I never thought about that stuff.
Yeah.
Now, my thing is,
And
how come they haven't changed it if she's still getting clots and
Yeah,
having
because
like,
I had
why
that
aren't they
clot.
changing it?
Yeah, I had the clot in the back of my head when I had that real bad stroke back in December.
yeah.
Because they had to intubate me and life flight me because I quit breathing and everything. And
You are the
that was
most functional person I've ever seen
that
or
was
ever
my bad stroke.
experienced on
That was my
intubation.
bad stroke. And that was a blood clot that caused
Yeah.
that one. And then I had a blood clot in the left cerebellum of my brain, and that's the
Uh,
what is it, Kim? I can't remember. The Douglas, Kim, you guys know.
I'm not sure what you're trying to get at.
The cerebellum, the function,
Right. You had this cerebral stroke.
no, this last one was in the cerebellum, the function of the,
Involuntary.
no.
Are you trying to what it affects?
I,
Is that what you're trying to get at?
yeah,
Thanks.
yeah. I hate that my
Your motor
memory's so messed up.
your
My
motor
my
function.
motor function, yes,
Yeah, your
yes,
motor function.
yeah. And
Sorry, I wasn't sure what you were getting at. Yeah.
yeah. So,
But you were
it was the
she was
cost that
she
brought that up.
impresses me. She always knows she needs to call the Leg Saver hotline to help advocate. I was impressed. I think you got a hold of Douglas, and she calls Douglas
That's when I
while
had my stroke in December, and
right,
I
but
don't
I was
remember
so
doing it.
impressed that you couldn't speak, but the nurse was in the room, and but you were intubated, but yet you were able to call Douglas, and Douglas is like, "She wasn't saying anything. I don't know what's going on. I think I heard hospital stuff in the background. I think you need to call back."
And the thing
Okay,
is I don't remember any of it.
but it's crazy because as she was intubated, so I called and you answered, and the nurse talked to me.
Yeah,
And
I
she
don't
said,
remember.
"Yeah, I don't know. She wanted me to answer this phone and wanted me to talk to you." And so it was great because we could help better understand, and then I could talk to your sister about what was going on. And um, but I was pretty impressed that you were
My
debated
sister
and
plays a
able to
big
call for
part
an
of
advocate.
medical. My sister plays a big part of my medical team.
She was great. She
My
was
sister May.
she's a little fighter. I liked
She,
her.
yeah, she's something else. She's got a lot of medical knowledge and backgrounds. She needs
Yeah,
to go back to medical degree. She's a certified medical assistant right now, but she was going to
I
go back
love
to
it.
school for nursing, but she's just, I don't know, she needs to do it.
Yeah. I'm so I've just been impressed about, just you really worked so hard. I just want to see you be able to just take a nice deep breath and feel like, okay, I can live my life a little bit now and not worry about when the next 911 is going to have to happen because you've just had just one thing after another. And I think I felt so much more comfortable today after you told me what your nurse practitioner told you and the strategy that she has, and she seems committed. So it sounds like you're in really good hands
Well, she told me that my
with her.
carotid, I can't say it,
Carotid.
carotid
Carotid, yeah.
arteries are 30% narrowed are on both sides. And she said that they weren't going to worry about that and that I shouldn't worry
Yeah.
about that right now until they're 70%. So they're not even going to worry about those right now. So,
And we have people that have 100% blocked carotid.
oh,
But the
wow.
the key is that you want to talk to them about inflammation in your body. So what's your CRP? And then there's another marker for artery health. It's LPPLA2. And if it's not covered by your insurance, if you need me to cover that for you, I think that that's worth just seeing if your arteries are on fire. It's what they consider an experimental blood marker, but I just found out there were a couple patients that have come my way recently, and they had it on their blood sheet. I was like, "Are you kidding? Your doctor ordered that?" Because I had to fight to get that for, my dad and my mom.
What
So
is it called?
it's LPPLA2, and that's
LP.
for artery. There's also another enzyme I'd have to get for you. It's in our book. So if you pick up our book, the peripheral artery disease book, I can get it for you. We have to charge $20 on Amazon because it's $18.75 for printing cost. So we make $1.25. I just rounded it up a little bit. But if you can't, I can send you an online copy, just a digital copy. Um, and Dean, I should get that for you guys as well. We should probably talk about getting you some of those worksheets and maybe co-branding and getting your branding on there so that you guys have some of those worksheets that you can also send, to people in case they need some help on diet. It's all been um, reviewed by world-renowned diabetes reversal expert Dr. Michael Danzinger, who's our chief medical officer. But and it's a lot of it was when he was the chief medical officer for Boston Heart Diagnostics, which has the most advanced blood work. If someone can afford blood work and if insurance covers it, highly suggest Boston Heart Diagnostics. They
Is that
do all of this
Boston,
blood work.
BOC, Boston, the city?
Boston Heart Diagnostics, but you
Okay.
can get that, for example, you can call them. I think it's like bostonheart.com or something. You can look it up. But when you talk to them, you can call them and ask them for a doctor in your area that orders their blood work or works with them. And you need to check to see that it's covered by your insurance. It's covered by Medicare. I just don't
Yeah, I have,
know
that's
what
what I have.
supplements.
Yeah.
So he even had at one point he had a nurse that came to the house and took his blood for it. But
I could
my
drive to
dad, and this
Boston.
is, something like April for your dad, that with my dad captain in the military, I captain, if it's not, if there isn't data, if he can't see the blood work, if he can't see it with his own eyes, he's not going to do anything. So the Boston Heart Diagnostics blood work was a game changer because he said, I don't understand. My cholesterol is normal in a basic lipid panel. I'm fine. But with Boston Heart Diagnostics, we were able to get an advanced lipid panel. And the advanced lipid panel, it doesn't just measure the quantity of your HDL and LDL, it actually measures the quality. Do you have a bunch of, for example, large fluffy LDL particles? You could have a whole bunch of those, and that's fine. Those aren't going to cause you a lot of trouble. It's the small, dense LDL particles that when they become oxidized by trans fats and free radicals, things like that, that they're going to eke into damaged areas in your artery walls and push that out. So it's worth knowing, okay, do I have a lot of these? If so, we need to seek out some more answers. What's damaging my artery walls? Is it smoking that's causing inflammation? Is it other environmental factors that are causing inflammation? We had a patient that was in a factory. She didn't have any other risk factor except she was breathing in, this sounds really perfume. So she worked in this factory that had a lot of perfumes. They were like cosmetics and things like that. So she was breathing this in all day long. And what her doctor told her is that it wreaked havoc on her arteries. It just caused inflammation in her arteries, caused damage to her artery walls. I don't know clinical evidence for that, but that's what the doctor told her. So there could be things like that, environmental factors. If you're a bunch of factories and you're breathing in chemicals, that could do it. But there are a lot of different things that can, damage your artery walls. And that's really the key. It could even be nurse practitioner Deidre Arms talked about issues with your gut. If your gut lining is not intact, that can also wreak havoc. If you have bad bacteria in your gut, we're seeing more issues with that, with Parkinson's disease and I think it's multiple sclerosis. They were saying a lot of that could stem from bacteria in your gut or other factors. So, seeing a really good internal medicine doctor is also suggested, and having an advanced, stool test that you can send it off and find out if there's any additional bacteria in your gut that might be causing a problem. It's just there's so many different things that I know I'm overwhelming people, but that's why we have our hotline, is because we can listen to your story. We're not clinicians or physicians. We do not give medical advice. But what we do is we help you to be more informed and have better questions to ask your doctor so you can get to the bottom of what's going on for you so that you can take those tangible steps to improve your
Oh,
prognosis.
so
Because
great.
P.A.D, you can improve your prognosis. It is possible. It might be a progressive disease, but you can stall progression with so many
And you
different
can do it with
things.
one leg too. You can do it with
Yes,
Yeah.
you
one
can.
leg.
Would a vascular medical doctor be the one that would also prescribe these tests?
I love vascular medicine doctors.
Okay, well, I'm going to love one, hopefully soon.
So I believe that it was Cleveland Clinic, and it might be completely wrong, but I think they were the first to certify. But you do have the Society for Vascular Medicine, that they may have some folks, but I am in contact with the Society for Vascular Medicine and some of the doctors there. So if you are in an area that you can't seem to find one right off the bat, I am happy to check with some of the folks at the Society for Vascular Medicine and see who is in their membership that has vascular medicine certification.
Okay, and I could get that from the hotline as well? That information,
Yeah,
who would be my okay, great. Thank you so much.
just just ask for me. And you can also, you're in the group, you can also, direct message me. That's always possible. We do have a leg saver text line that you can text. It's not the regular 833 PAD legs. That one you can call. But we do have, I can put in here, you can text this number as well, and we can text that way.
Okay, great. I'm gonna write.
320-7138. That's the texting number that you can just uh text, and I can get on
Where
with my team.
wait, where's the number? 3
415-320-7138 is the number.
Okay,
It's
thank you
over
so
there
much.
in the chat. Yeah,
Okay.
that's the texting line. So you can definitely drop a text, in there if you want, but you can just let me know who you are and that you need to speak
And where
to
I am.
Kim.
Yeah.
My team, can talk to you about collateral vessels, things like that. But when it comes to doctors and helping you with some of those things, I usually like to be involved because I have the relationships with the doctors, and I've been in the procedure. I've been in, thousands of hours of procedures. I've seen these things. I've been in clinic with these doctors since 2016. I've heard the conversations they have with patients, and so I just like to
Be great.
make sure that I'm the one that helps you with some of that information. But we can create, one of the values that I think that we provide is we can help you with a worksheet, that, with the questions to ask your doctor, prior to any of your, appointments. We can
Okay.
help you sort it out because I don't know about you, but you walk in there and then you forget half of what you wanted to ask.
Well,
Or
they're rushed. They're so rushed.
yeah.
They are.
And so what we can do, sometimes what we'll do is we put together the one sheet, with the questions and your goals. And one of my favorite questions that I put out there is, when you go to this appointment, what will leave you satisfied? What will make you feel satisfied in leaving this appointment? Now, you may not, if you cure my pad, cure my PAD, if that's the only thing that you're going to be satisfied with, you might be an unhappy camper. But we talk about some realistic goals so that the doctor understands that this is my ultimate goal with this appointment. And sometimes knowing that going in and letting them know that going in is really important. And I know that that was something with you, Beth, and I think you went in really prepared today with your nurse practitioner. We had long conversations about this. And
Mm.
last week, especially during this session, we talked
Yeah.
extensively about your situation. And so I think that your advocacy for you led to a very productive, um,
Yeah,
discussion.
because I want to, because I want to know what's causing these strokes. Why am I having so many?
Yep.
Why is this happening? I want to know, you know,
Yep.
and
Exactly.
now I have to deal with neurology, and I'm waiting for neurology. Neurology really doesn't want to do too much. They're telling me that I have to go through my PCP doctor, my primary care doctor,
Yeah.
have my primary doctor deal with it when my primary doesn't really deal with stroke, and that's neurology. So it's like, come on, people, get your, excuse my language, but get your heads out of your asses. Let's get this on the road. I
I know this is
stroke to
something
happen.
that
I want to get this taken care of.
Alan has had to deal with a lot of that. You ever feel like you're caught in the middle of this web in the healthcare system, and you have this problem, no one can figure it out. So then they say, well, you're this person's. And Alan, we've talked about this, right? You go to
Yeah.
the pain doctor. The pain doctor says, I can't do anything. Go back to your primary care. Your primary care says, I can't do anything. Go to the neurologist. The neurologist says, why are you here? go to your vascular doctor. And then you're caught in this middle and you're getting no answers. In the meantime, you can't sleep. Your pain is intolerable. And it's just
Kim, that's how I
horrible.
was when I was so sick. Remember when I was so sick there for that longest time with that
Yeah.
cough and everything? And it took my ARNP cardiologist to put me on the strongest dose of prednisone that she could give me. And it finally got my voice back and it got me to feeling better. It took my cardiologist to figure stuff out. Nobody could
Yeah.
figure anything out except for my cardiologist, and she got me feeling better.
It
Let me
sounds like
tell
you
you a
really
funny
found a
story.
good gem. When you move, you better keep this cardiologist, this cardiology group you're with, because they seem to really take a holistic approach. They don't leave any stone unturned, and they don't leave you with unanswered questions when you walk out the door. They make sure, even
Yep.
if it's not their realm, they're going to find help you figure out what's going on, and that's really cool.
Yeah, yeah, absolutely.
Yeah.
I love my
So,
cardiology. They're amazing.
well, it's been really fun with everyone here, and it was a really good long discussion. So,
Yes.
Was,
tomorrow we actually have an interesting, so if any of you has some imaging and such and you have questions about imaging, we have one of the top technologists on the planet that is going to she retired and she has offered to do a couple of sessions a month with us, helping people to understand their imaging, not giving diagnosis, but helping people to understand the terminology and what they're reading. And tomorrow we're going to honor her with the Lifetime Achievement Award for vascular diagnostics, which I'm really excited about. And
Cool.
she might be able to answer a few of your questions. And then Friday we have Dr. JD Coral, that is causing me to bump Dean. I'm so sorry. Maybe Dean will join that discussion as well, and then we can chat afterwards. Because it should be
yeah,
a really good discussion with Dr. Coral. Friday night, I'm not sure. Um, we have our vascular surgeon of the year, which is Dawn's doctor. Um, and she was on Capitol Hill this week. So they had a big meeting I didn't talk about on Capitol Hill this week with a bunch of vascular surgeons. Our 2024 vascular surgeon of the year, Jacqueline Majors from Memphis, was joined by Dr. Anita Duwa from Boston, who's our new vascular surgeon of the year for this year, and a bunch of other people from the Society for Vascular Surgery. And I thought they were going to Capitol Hill to talk about what's called the ARC Act, ARC, the ARC Act. And that ARC Act, it kind of lost some traction when the champion for it ended up passing away. He had PAD, but I'm not sure the exact cause of death, if it was heart attack or what. But needless to say, it stalled out afterwards. And the ARC Act, the whole goal was to make sure that anyone with high risk factors, that insurance would cover the early testing for PAD. And so I thought that's why they were going back to Capitol Hill, but it turns out, which I find even, more interesting, is that there's some sort of, I don't know if it's the Elder Act or something that they're promoting, which is getting legislators to do something about the pre-authorization debacle that is leading to patients who have critical limb ischemia, advanced stage PAD, getting delays in their procedures to save their legs. And so I'm curious to hear the outcome, of those meetings. I'm hoping and crossing my fingers, but isn't it nice to know that we have these great surgeons that are, fighting for our rights and actually hoping to do something about these things that are happening that are causing delays in early intervention for patients with PAD. So, but I think Anita is supposed to come on at 5 p.m. Eastern time on Friday. So cross your fingers. She was supposed to be on Tuesday, but because she was on Capitol Hill, she's not. And then Saturday should be interesting because we have a doctor from Kaiser in San Francisco who is going to be talking about walking as medicine. We're honoring him with and his team with a the best PAD walking as therapy research, the research team of the year, I think it is. I don't hold me to the title, but we're going to be interviewing them on Saturday and Sunday. I think we have Giacomo Clarice from Italy. He's one of the top podiatric surgeons on the planet who's going to be coming and talking about foot issues. So that could be something, April. You might want to join for that as well. Maybe get Dad to join. So we got a lot going on. We have stuff going on, I think, every day, much to Josh, our producer's dismay. Clear through, I think, the first week in October. I
When
don't
was
think that we
the
have a day off.
podiatrist, the podiatric surgeon?
Dr. Clarici is, I think, on what is that Sunday?
Okay.
He's actually on, shoot, where did he go? I thought he was on that day. Where is he? I will have to look. Clarici. I will have to go back and look. We actually have Nikhil Patel. He's our Humanitarian of the Year award winner. He's coming on Sunday.
Okay.
But I know Dr. Giacomo Clarici is supposed to be on. I saw him on one of these days. I'm just not able to find him. But he is awesome. We have a wound doctor coming on the 25th. That is nurse practitioner Ann Walsh. She has an app. It's called Wound Care Pro. Wound Care Pro is amazing. It's like $4.95. Might be worth downloading it and taking a look and, getting some more information on gangrene, wet gangrene, things like that.
And what day is she
Oh, we
on?
have another podiatrist coming on the 27th as well. Our America's Podiatrist of the Year, Sarah Rose. Actually, I don't know, Dawn, if you ever saw Sarah Rose. She works with Dr. Dua at Boston Mass General. But she is the sweetest thing.
If I
She
haven't,
is.
I'll see her. I'll see her in 2 weeks because I'll be at my appointments. I have appointments on the 7th, I think it is, or the 6th of October. Dr. Dua. I go and
Oh,
see
that's
everybody. My yearly appointment.
that is actually right. You are absolutely right. I was going to print off an award that you could walk into her. Oh, here we are,
Oh,
the 29th. So the 29th is Giacomo Clarici. I might have to ask him because that's pretty late. That's like 10 p.m. or 11 p.m. their time in Italy. I'm not sure that he really realized what he was booking. And if he has procedures the next day and he's, with us till midnight, I wouldn't want to be his first patient in the morning.
No.
So, but we have a lot going on. So we have a lot of opportunities for you guys to ask questions. I think Josh is, and I don't know where Josh you're at in terms of putting together a form or getting me a link to a form that if you want to be in our live studio audience and ask questions, you can either join on YouTube and just put your questions in YouTube comments and we get every question answered as well. But if you want to join the live studio audience like this on Microsoft Teams, then what we do is I think we're going to have a link that you can join the live studio audience and we'll just notify you. You'll get a lot of emails, I warn you, because we're live a lot, but you'll get notified on everything that we have going on so you don't miss a thing. We have some people in the group like Beth and like Douglas, and there's also Marcia and Hines in the group that show up just about to every single one of these things. And they ask the same question every single time. They get 20 and 30 different opinions on the same question. So you
That's
get,
crazy.
opinions from doctors across the globe on anything that you need. It's not medical advice. As I said, we don't do medical advice, but you get different people explaining different topics and offering you information that'll help you formulate some really good questions to have a good discussion with your doc. So anyway, well, thanks everyone. It was really fun.
Thank,
We
thank
really
you.
exhausted this one.
Thank
What are we
you.
like 4 to 5, 2 hours,
Thanks so much.
You,
which is
everybody,
great.
for showing up.
Thank
Hopefully
you.
we'll see
Okay.
everybody back next Wednesday.
Bye, everyone.
Yep. Hopefully you'll come back next week.
Good night.
Bye.
Thanks,
Good night,
Josh.
everyone.
Good night.
Thanks, Kim. Talk to you later.
Thanks, you guys.